5 Best Home Remedies for a Sinus Infection. Have you ever felt like your whole head is heavy, as if there's pressure building up inside your face? You bend forward and your cheekbones start to ache, your forehead throbs, there's pain behind your eyes, and your nose just won't stop running. Sometimes the mucus even turns yellow or green. That's not just a bad cold. That's probably sinusitis, a sinus infection that affects millions of people around the world. Funny thing is, many of us rush to the pharmacy, grab a decongestant. It seems harmless. But using these too often can actually make things worse. They can trap mucus inside your sinuses, giving germs the perfect place to grow. And before you know it, a simple stuffy nose becomes a painful infection. So in this video, AQUAON will not only explain what sinusitis really is, but also share some simple home remedies that can help relieve the pain, and even prevent sinusitis from coming back. And just a quick note, this video is for educational purposes only, so if you have any medical concerns, please consult your doctor. Let's start with the basics. Take a look at your face. It's not made of solid bone. The bones in your forehead, your cheeks, and even those behind your nose are filled with hollow spaces, tiny air chambers called paranasal sinuses. Each of these sinuses connects to your nose through small openings, like tunnels. The ones in your forehead are the frontal sinuses, the ones in your cheeks are the maxillary sinuses, behind your nose sits the sphenoid sinus. And further back, tucked between your eyes, are the ethmoid sinuses. You might wonder, why does the skull even have these empty spaces? They're not useless at all. These sinuses are lined with a thin, living tissue called mucosa. It's a special membrane that constantly produces mucus to keep your nasal passages moist and protected. That mucus has a job to do. It traps bacteria, fungi, and microscopic dust you breathe in every day. It even carries antibodies that help destroy germs before they spread. And here's the fascinating part, the surface of that mucosa is covered with millions of tiny hairs called cilia. They move together in gentle waves, pushing the mucus, along with everything it's caught, toward your throat. Once it reaches your stomach, the acid there destroys all the germs. Now that you know how this system works, sinusitis will make a lot more sense. It simply means the thin lining inside your sinuses has become swollen and inflamed. Why the lining inside your sinuses becomes inflamed? The main cause is allergies. An allergy is basically your body's exaggerated reaction to something harmless in the environment, like pollen, dust, or pet hair. For example, when a few tiny particles of pet hair enter most people's noses, nothing happens, the body knows they're harmless. But if you're allergic, your immune system sees those harmless hairs as dangerous invaders. It sends out immune cells to attack them, and in the process, it also damages the delicate mucous membrane of your nose and sinuses. That damage causes swelling and inflammation. When this lining becomes inflamed, it produces more mucus as a defense mechanism. But that extra mucus often becomes thick and sticky, blocking the small passages that normally let it drain into your nose. As the mucus builds up inside your sinus cavities, whether in your cheeks, forehead, or behind your nose, it creates a warm, moist environment, truly a heaven where bacteria and fungi can thrive and run wild. That's when a simple allergic reaction can turn into a full-blown sinus infection, and that's usually when people end up needing to see an ENT doctor. The good news is, there's a lot you can do to prevent this buildup in the first place, and help mucus clear out more easily. Before we get to that, it's worth noting that allergies aren't the only cause of sinus inflammation. Smoking can irritate and inflame your nasal lining too, making it produce more mucus. And structural issues, like a deviated septum or other nasal blockages, can also make you more prone to sinusitis. So, what symptoms appear when your sinuses get blocked? Remember, these air-filled spaces don't just sit there doing nothing. They help keep your nose moist, act as part of your immune defense, and even shape the sound of your voice. When you speak, your voice bounces and resonates through these hollow spaces. That's why, when you're congested, your voice suddenly sounds muffled or nasal. It's one of the first signs your sinuses are clogged, the sound can't bounce around properly. But the most classic symptom of sinusitis is pain. It can show up in different places. You might feel pressure behind your eyes, pain in your cheeks or jaw, or a dull ache in your forehead. Sometimes, the pain gets worse when you bend forward, a clear sign one or more sinuses are blocked. That's also why doctors press on those areas during an exam. If they're inflamed, you'll feel tenderness or sharp pain. Another common symptom is fatigue. You feel drained, sluggish, like your energy's been zapped. That's because when the sinuses become infected, bacteria can multiply in the trapped mucus. Your body responds with inflammation and fever, which both use up a lot of energy and can leave you feeling weak. Another common symptom is a runny nose. At first, it may look clear and watery, which usually means you're well hydrated. But when the mucus turns thick and yellow, it's often a sign of infection, and dehydration may also be part of the problem. If the mucus looks brownish, it may contain traces of blood from irritated nasal tissue. And speaking of bleeding, nosebleeds are also common when your sinuses stay blocked. When your nose feels stuffed all the time, you keep blowing it forcefully to try to clear it. Over time, that pressure can break tiny blood vessels inside the nasal septum, leading to a nosebleed. What's more, you might be wondering, why does sinusitis often make you cough? Here's why. When your sinuses produce too much mucus, it doesn't just come out through your nose, it can also drip down the back of your throat. At night, when you lie down, gravity pulls that mucus downward. This is called postnasal drip. Those constant droplets sliding down your throat irritate the lining of your larynx, and that irritation triggers coughing. That's why many people with sinusitis have a persistent, annoying nighttime cough that keeps them awake and makes them even more tired. Now that we know what's really happening inside your sinuses, let's get to the part everyone's waiting for: 5 home treatments. Which ones actually work, and which ones don't? 1. Nasal spray. There are several types of nasal sprays. Some are simple saline sprays designed to keep the nose moist. They come in small, gentle bursts or continuous sprays. Now, these sprays are very safe, but the main problem is that many people use them incorrectly. Most people insert the nozzle straight into the nostril and spray twice. That's not right. This way, most of the liquid stays in the front part of your nose, where there's very little mucosa, so it doesn't actually humidify the nasal passages. The correct way is to hold the bottle at about a 45-degree angle, pointing slightly toward the area under your eyes. Our nasal cavity extends backward, not straight up, so this direction helps the spray reach the right area. Spray 3 or 4 times, hold your breath for a few seconds to let it circulate, then breathe deeply. Don't blow your nose immediately after, just wipe away any excess. Repeat the same process on the other side. That's the proper way to use a nasal spray. So, what happens when you do it correctly? Think of the mucus in your nose as layers, a sticky mucus layer and a thinner, watery layer underneath. When you spray, the moisture droplets stick to the mucus and help loosen it, making it easier to clear. That's why your nose might run a bit afterward. The mucus that was trapped is finally coming out. There are also medicated sprays, such as corticosteroid sprays, which reduce inflammation in the nasal lining. One of the main causes of sinusitis. These should only be used under the guidance of an ENT specialist. 2. Nasal rinses. Nasal rinses are one of the safest and most effective ways to clear your sinuses. They help flush out mucus, dust, allergens, and irritants, keeping your nasal passages clean and reducing congestion. Use distilled, sterile, or boiled and cooled water. You can add a pinch of salt or use a saline physiological solution. Next, take the syringe or rinse device, tilt your head slightly forward, and gently insert the tip into one nostril. Breathe through your mouth, keeping it slightly open. This closes the larynx and prevents water from going down your throat. Gently push the solution so it flows from one nostril to the other. Then repeat on the other side. Nasal rinses don't cure sinusitis, but they create the right environment for healing and help prevent flare-ups. When the nasal cavity is clean, sprays and other treatments can reach deeper and work more effectively. Just like brushing your teeth doesn't cure cavities, but keeps your mouth clean and helps prevent them from coming back. 3. Steam inhalation. Steam inhalation helps clear your sinuses and loosen mucus, making it easier to breathe. It's not a complete cure for sinusitis, but it's definitely worth doing. That's because steam helps open up your sinuses, allowing other treatments to work better. When your sinuses are still blocked and full of mucus, sprays or other remedies can't reach the inflamed areas effectively. When you steam, the warm, moist air softens the mucus in your sinuses, making it thinner and easier to drain. This can relieve nasal congestion and reduce that heavy head feeling, without medication. Steam works best when your nose is at least partially clear, meaning you can still breathe a little through it. If your nose is completely blocked or very swollen, the steam won't reach deep into your sinuses, it will only warm the surface. So, it's best to steam at the first sign of congestion or a heavy head, rather than waiting until your nose is fully blocked. Use water that's hot but not boiling, and keep your face about 12 to 16 inches from the water. You can add a few drops of eucalyptus or peppermint oil to help open your nasal passages. Steam for 10 to 15 minutes, then gently blow your nose to clear the loosened mucus. Avoid steaming too long or using water that's too hot, as it can dry out and irritate your nasal lining. In simple terms, steam inhalation helps loosen mucus, opens your airways, and allows your sinuses to clean themselves, kind of like how steam softens dry dust on a glass surface. 4. Stay hydrated. There's something important that many people overlook: mucus actually has layers. One of those layers is made mostly of water, and another is made of thick, sticky sugar molecules. When the water layer increases, mucus becomes thinner and easier to clear out. But if the mucin-rich layer thickens, it turns sticky and much harder to remove. That's why staying hydrated is so important when you have nasal congestion, a cold, or the flu. So when a doctor tells you to rest and drink plenty of water, don't underestimate it. It really works, and you can often notice improvement within hours. 5. Skip milk, go anti-inflammatory. A true story, how quitting milk changed everything. Let me share something truly inspiring. Jarna, a 41-year-old mother of twins from India, had been struggling with chronic sinusitis for many years. She had tried everything: steam inhalation, nasal sprays, aromatherapy, even surgery to fix a deviated septum, but nothing brought lasting relief. Then one day in 2019, she decided to stop drinking milk completely. She had been drinking fresh cow's milk every day since childhood, especially after giving birth to her twins. She thought she couldn't live without milk, but she was so tired of her sinus flare-ups that she decided to quit for just 1 month to see what would happen. At first, it wasn't easy. That morning glass of milk kept her full and alert throughout the day. So she replaced it with a warm drink made from turmeric, black pepper, and a squeeze of lemon. Since that day, Jarna hasn't had a single sinus infection. It's been over 3 years now. Even when she caught a cold, cough, or COVID, her sinusitis never came back. She noticed that drinking this mixture first thing in the morning on an empty stomach made her body respond much better. She still eats dairy products like butter, ghee, and cheese, but avoids milk completely. So why did cutting milk make such a big difference? This can be explained by a scientific reason: a cow's milk protein allergy. When someone is allergic, their immune system overreacts to proteins in milk, such as casein and whey, treating them as harmful invaders and triggering inflammation to fight them off. This reaction doesn't just happen in the gut, it can also affect the upper respiratory tract, causing symptoms like nasal congestion, sneezing, and swelling of the nasal lining, which makes the sinuses feel blocked and unable to drain properly. Many people are actually allergic to milk proteins without even realizing it. They keep drinking milk every day as if nothing's wrong. But when they stop, their body is no longer exposed to the trigger, the inflammation begins to fade, and symptoms like sinus congestion or allergic rhinitis often improve. That's why some people find their sinus infections go away after they stop drinking milk. Meanwhile, the turmeric, black pepper, lemon drink Jarna used naturally supports the body's healing process. Turmeric contains curcumin, a powerful anti-inflammatory compound. Black pepper boosts curcumin absorption by up to 2000%. Lemon adds vitamin C and potassium to support your immune system. Her story shows that sometimes, just one small change in your daily routine can make a huge difference. And what's even more amazing, in the comments under her video, so many people said they tried quitting milk and drinking turmeric, black pepper, and lemon just like Jarna, and their sinus problems went away too. Her story isn't just a personal experience, it's something that has inspired countless others to make the same change. If you've tried everything for sinusitis and nothing seems to work, try skipping milk for a few weeks and replacing it with a warm turmeric lemon drink. Who knows, your body might respond just like Jarna's did. You can watch Jarna's full story on her YouTube channel, the link is in this video's description. And to wrap up this video, AQUAON is sharing a sinus relief trick from the famous Dr. Mandel, that can help reduce sinus congestion, ease facial sinus pain, and clear a stuffy nose almost instantly. Place your thumb under your cheekbone, press gently, and push toward your ear. With your other hand, gently hold your ear and pull straight out, holding for about 10 seconds. You should feel your sinuses opening up. Release and relax, then repeat on the other side. Next is a breathing technique combined with nasal pressure to help mucus drain. Pinch your nose shut with your fingers, take a deep breath through your mouth, and tilt your head back. Hold your breath and the tilt as long as you can. When you can't hold it any longer, release your fingers, exhale fully, and bring your head back to its normal position. Then try breathing in through your nose. Dr. Mandel calls this technique almost magical and recommends doing it regularly whenever you feel congested. So, now you've seen some simple ways to relieve sinusitis right at home. Try them one step at a time and notice how your body responds. Be patient, healing takes time. And that's everything AQUAON has for you. If you found this helpful, hit that like button and subscribe, it really keeps us motivated to bring you more useful videos. Thanks for watching, and I'll catch you in the next one.